My name's Alexa Hoffman, and I would just like to ask you to imagine waking up and suddenly being unable to hear out of one or both ears. This is a common sign of what is known as sudden sensorineural hearing loss, or sudden deafness. The National Institute of Deafness and Other Communication Disorders, or the NIDCD, estimates that this is a reality for between 1 and 6 per 5,000 people. To put that in perspective, that's between 65,000 and 394,000 people in the United States alone. The NIDCD even says that this estimate could be lower than the reality, as sudden deafness often goes undiagnosed or misdiagnosed. Sudden deafness affects both young and old alike, but typically affects those within the age of 40 and 60 years. This is considered a type of sensorineural hearing loss. This type of hearing loss is when the inner workings of the ear, such as the stereocilia within your inner ear, or the nerve responsible for sending the electrical signals of sound to your brain for processing, are affected in such a way that makes them unable to function properly. Along with sudden deafness frequently being misdiagnosed or undiagnosed, the cause is often unknown. Only 10% of people with sudden deafness can identify a cause. In those few cases, it has been attributed to things like trauma, such as domestic violence or injuries from sports and automobile accidents, infection, autoimmune diseases, drugs for severe infection or cancer treatments, blood circulation problems, neurological disorders, and disorders of the inner ear. Sudden deafness can happen overnight or gradually dissipate over the course of a few days. If someone suspects that they have sudden deafness, their doctor may look for common signs. One test that might be conducted is pure tone audiometry. During a pure tone audiometry exam, an audiologist will provide sound in the form of a pure tone, or a sound wave along a single sinusoidal waveform. They will then ask the patient to alert them when they hear the sound. By affecting the sound levels of the tone, the audiologist can then determine the range of the hearing of the patient. Once one has been diagnosed with sudden deafness, which is often attributed to a sign of a hearing loss of 30 decibels or more, they will often look for an underlying cause to the sudden deafness. The idea is to look for any problems from those causes and see if they can be fixed or prevented for the future. In some cases, sudden deafness may be reduced or reversed, but oftentimes there are permanent deficits to the hearing loss. The National Institute of Health states that there is only a 2 to 4 week window for treatment before the hearing loss becomes permanent. So it's important to contact your doctor immediately if you're experiencing any signs. With treatment, restoration of hearing loss can take months. Treatment depends on the cause, if one is found. For instance, if it is an infection, antibiotics may be prescribed. If it's because of a current medication, an alternative may be found. If it's because of an autoimmune disease, where your body is attacking itself, basically, immunosuppressants may be prescribed. Oftentimes, steroids are prescribed, and they're prescribed in order to help potentially restore some hearing in patients. Oral steroids may be taken, or steroids can be directly injected into the middle ear. The National Institute of Health funded a study that showed both oral and injectable steroids worked effectively to treat sudden deafness. Oral steroids are optimal as far as cost and convenience are concerned, as well as comfort. But oral steroids can come with a host of side effects such as weight gain, mood changes, and more serious ones like high blood pressure or elevated sugar levels. For those who cannot take oral, the injectable steroids can be used. They are uncomfortable because they're injecting it directly into your ear, and they must be administered by a medical professional, which is inconvenient. But they bypass many side effects of the oral steroids, making it available for some people who cannot take oral steroids for medical reasons. Because sudden deafness often results in permanent damage to hearing, many move on to oral rehabilitation after being diagnosed. Depending on the severity, hearing aids or cochlear implants may be recommended to restore hearing. While sudden deafness sometimes only affects one ear, having hearing only in one ear can come with a lot more problems than most might expect. Without stereo hearing, for instance, your brain cannot tune out background noise, and hearing during loud situations such as restaurants or in conversations with multiple people may be difficult. There are a few well-known celebrities and politicians with sudden deafness. For instance, actor Rob Lowe from The West Wing and Parks and Recreation suffered from mumps as a child. Because of mumps, which is a common cause of sudden deafness in children, he can't hear out of one ear. Actress Halle Berry from movies like Catwoman, Die Another Day, and Gothica suffers from sudden deafness in one of her ears. Hers was caused by domestic violence earlier in her life. Because of the assault, her left eardrum was ruptured and she lost about 80% of her hearing in the left ear. While sudden deafness can certainly change someone's life, technology has made it a much easier and more livable condition. With things like hearing aids, cochlear implants, and assistive listening devices in many forms, those with sudden deafness have the means to adapt to their new situation. And while it's not easy, and they listen to the world differently from others, those many, many thousands of individuals can go on to live normal lives. Thank you for listening to me talk on sudden deafness, and I hope you learned a little bit today.